Leishmania infection, a parasitic disease, also called leishmaniasis, spread by the bite of sandflies infected with a protozoa Leishmania. There are several forms of leishmaniasis, the most common being cutaneous and visceral leishmaniasis. The cutaneous form of the disease causes skin sores while the visceral form strikes internal organs of the body such as the spleen, liver and bone marrow and can be fatal. Cutaneous leishmaniasis involves one or more sores on their skin. The sores can change in size and appearance over time. They often end up looking like a volcano, with a raised edge and central crater. Some sores are covered by a scab. The sores can be painless or painful. Some people have swollen glands near the sores, for example, under the arm if the sores are on the arm or hand. Visceral leishmaniasis usually causes fever, weight loss, and an enlarged spleen and liver. Usually the spleen is bigger than the liver. Some patients have swollen glands. Certain blood tests are abnormal. For example, patients usually have low blood counts, including a low red blood cell count, anemia, low white blood cell count, and low platelet count. There are about 2 million new cases of leishmaniasis each year, 1.5 cutaneous and 0.5 million visceral. The disease is found in the following areas: Mexico, Central America, and South America, from northern Argentina to southern Texas. Not in Uruguay, Chile, or Canada. Southern Europe. Leishmaniasis is not common in travelers to southern Europe, Asia, not Southeast Asia, the Middle East, Africa, particularly East and North Africa, with some cases elsewhere. More than 90% of the world's visceral leishmaniasis is in India, Bangladesh, Nepal, Sudan, and Brazil. Leishmaniasis is not found in Australia or Oceania, that is, islands in the Pacific, including Melanesia, Micronesia, and Polynesia. It is possible but very unlikely to get leishmaniasis in the USA. Very rarely, people living in rural southern Texas have developed skin sores from cutaneous leishmaniasis. No cases of visceral leishmaniasis are known to have been acquired in the USA. Leishmaniasis is spread by the bite of some types of phlebotomine sandflies. Sandflies become infected by biting an infected animal, for example, a rodent or dog or person. Since sandflies do not make noise when they fly, people may not realize they are present. Sandflies are very small and may be hard to see. They are only about 1/3 the size of typical mosquitoes. Sandflies usually are most active in twilight, evening, and night-time hours from dusk to dawn. Sandflies are less active during the hottest time of the day. However, they will bite if they are disturbed, such as when a person brushes up against the trunk of a tree where sandflies are nesting. Rarely, leishmaniasis is spread from a pregnant woman to her baby. Leishmaniasis also can be spread by blood transfusions or contaminated needles. People of all ages are at risk for leishmaniasis if they live or travel where leishmaniasis is found. Leishmaniasis usually is more common in rural than urban areas, but it is found in the outskirts of some cities. The risk for leishmaniasis is highest from dusk to dawn because this is when sandflies are the most active. All it takes to get infected is to be bitten by one infected sandfly. This is more likely to happen the more people are bitten, that is, the more time they spend outside in rural areas from dusk to dawn. Adventure travelers, Peace Corps volunteers, missionaries, ornithologists, people who study birds, other people who do research outdoors at night, and soldiers are examples of people who may have an increased risk for leishmaniasis, especially cutaneous leishmaniasis. People with cutaneous leishmaniasis usually develop skin sores within a few weeks, sometimes as long as months of when they were bitten.